Well, from the standpoint of traditional Chinese medicine, marijuana is just like any other kind of an herb. It has certain qualities. And those qualities, we say, are that it's very hot, and we say it also has a certain poisonous quality in it as well. So the heat affects the people who take it in a very definite progression. And whether those effects of the heat affect you in a way that is going to be something that you consider to be a positive effect or a negative effect is going to completely depend on what's going on with you. So the heat tends to dry people out. Okay? So if you begin to take marijuana and you already have a problem with having dryness in your respiratory system, it's going to dry you out even more. So it's going to be what you would consider a negative side effect. But if you're somebody that, say, has a lot of phlegm in your system, it's going to dry that out and you're going to think it's a miracle drug, right? But really it has to do with the combination of what's happening with the marijuana and what's happening with you. Now, anybody who takes marijuana is going to, if they expose themselves to it again and again, it's going to have a certain progression that it takes through their system. And that's the progression of the heat and the little bit of poison that's in it. That's the effect that it has over time as it affects you. Now, depending on what you bring to the table in terms of your own health, in terms of how balanced you are already, that's going to affect you in different ways. So if you're weaker when you go into your relationship with marijuana, then it's going to have more of an effect on you just because you have less bandwidth to take care of some kind of a pathogen entity, right? In a nutshell, we can go into a lot of detail on the websites that we created. We have many, many, many pages of all the different effects. I just call them all effects now because the side effect is something that, that's all a question of definition. But so what we're trying to do is we're trying to define the effects of marijuana as much as possible. And at this point, I have over 219 different kinds of effects. I call them each one of them a marijuana syndrome that can be confusing to people when they're experiencing them because sometimes it's difficult for them to discern, well, what's really them and what's really the marijuana. It's also very difficult for a clinical practitioner to discern what's going on with people when they come in because more often than not, when someone goes in as a patient who takes marijuana to go see a medical practitioner, much more often than not, they don't tell the medical practitioner that they're getting loaded all the time. And so what happens is it's a big confusion for the medical practitioner because they don't know what is going on with the person themselves and what's going on with the marijuana. So part of what I'm doing in my research and my work and trying to educate people is I'm trying to help the healthcare practitioners to be able to understand and distinguish the differences between, okay, well, this is the marijuana, this is the person, but you have to deal with it anyway. So how do you do that? That's part of my current focus of educating people.